Welcome back to the Run Radio podcast. My name's Trina Wilcox, and together with the Arthritis Foundation of Missouri, we get to talk to some great people doing great things for rheumatology right here in Missouri. And today, my guest, Dr. Sona Kamat, welcome.
Thank you, Trina. Nice to meet you.
You're the owner of West County Rheumatology. What is that like?
So West County Rheumatology is my private practice, and I started that in 2018. And it's been an amazing journey with this practice. I've gotten to build it from the ground up and lay that foundation as I want it. Over the years, I've practiced in academic medicine and then, with a hospital-based system. And, to do it the way you want to do it, it's a whole other ballgame, and
Yeah.
it's been a lot of fun. So it's a private practice. We see rheumatology patients and take care of autoimmune disease.
What made you go into that field anyway? I've always been curious how doctors decide what, specialty they're going to look at and go into and dive into.
Um, you know, I think it was because I had family members that had rheumatoid arthritis, and oftentimes it's your encounter in some capacity with an illness or a disease, or sometimes it's a mentor. And in residency, I had two phenomenal rheumatology mentors, and it motivated me to really look deeper into this specialty. It's a quirky little specialty, and I like that too. It's very eccentric. And it was in its infantile stages when I started, and there was so much room for growth and expansion here, and I just found that to be really appealing.
I mean, the way medicine has advanced, even since I was diagnosed as a child, has, made such a difference. And hopefully, a lot of younger patients won't have to have some of the damage that a lot of us have had. Hopefully. Why do you find it so quirky? And that intrigues me. What's so quirky and so such an enigma about it? Because I feel that way, but it's nice to hear that from somebody on your side too.
Well, I think most rheumatologists enjoy being thought of as being a little eccentric. We don't mind that, kind of title. Most of my friends actually enjoy, being something a little bit off the beaten path and doing something different. The immune system's fascinating. And then there's so much information and knowledge that takes place, from year to year. And just like you said, 20 years ago, 25 years ago, when I started in this specialty, we didn't have the medications we did. And some of these newer medications have just changed the face of, an entire disease process. So we, hopefully won't be seeing patients in wheelchairs and destruction and deformity that takes place. But because we're constantly moving and renaming things and learning, organ systems, you can cut them open and say, oh, there are two chambers on top, two on the bottom. But the immune system's not like that. They're a group of cells and they're on the move day to day, month to month, year to year. And so even what we see today might not be what we see, in a couple of years in the same patient. And so there's a lot of information that comes out each year, and there's a lot of learning that has to happen each year.
I recently described arthritis, especially rheumatoid arthritis, to someone as kind of like a tornado. You don't know where it's going to hit in the body and who it's going to hit, and it hits us all differently. And I'm just wondering, like, where do you see it going in the next 5 to 10 years, even with being able to control damage, or what things are we looking at that we might not be on track with now?
I can only hope, Trina, that in the next 5 years we have, solutions.
Yeah.
Right now we're still in that phase where, I mean, we have phenomenal medications and we can really put people into remission and give them back a quality of life that we could not do 20 years ago.
Mhm.
With that said, I would love to see in the next 5 years the ability to really put people, into a quiet remission-like phase where they really are able to modify, their lifestyle and understand what their triggers are to be able to avoid them and to be able to have a handle on this disease process where it gives that control back to the patient. And like you said, I know what you're talking about. Sometimes it's a shoulder, sometimes it's a knee. You don't know, and you've eaten well, and the weather is nice outside, and still you'll have an attack. And so, so I would like to see that we are able to give patients a little more control over that, so that sense of helplessness is taken out of that disease process. But I would love to see cures, of course, right?
Of course,
Isn't
yeah,
that
for
what
sure.
our goal and aim should be?
Have you had much studying on RA patients and COVID and long COVID? And what's that been like, if so?
We're seeing a lot more, and not just long COVID, but all these different aspects of COVID. And we're still learning about COVID. It is not done yet for sure. And it triggered the immune system. Definitely, it's one of these viruses that triggers the immune system. And what we saw was those patients that had autoimmune disease, COVID actually made some of their parts of their disease process worse. And then there was this whole other group of patients that may have been sitting there on the fence, and they were getting by without the full-blown disease process. And then COVID came along and tipped them over. And now suddenly they have abnormal blood work and they have symptoms that they're dealing with. So it impacted autoimmune disease in general.
And I know we're constantly learning, like you said, so much about it. What's your confidence level on finding out how to stop, control, and deal with it, if even find a cure with the COVID disease and working with the immune system? I mean, what's it looking like to you? How confident are you that it's going to happen soon?
I'm not sure I can say soon, but the good news is that there's so much research and it's all over the world. It's not just us or an isolated area, or it's not just one little community that's having to deal with it. It's the entire world that's having to deal with it. And if anything, it brought the medical community around, globally together. And so there are a lot of intelligent people out there and a lot of different, groups of people, and this diversity even in healthcare that's come together and put their minds together to try to find solutions and give us better answers. And so I think that's the good news, that we've got a large group of people working on this. Will we have something in the next few years? Hopefully.
Hopefully. We sure hope so. So let's talk about your involvement with the Arthritis Foundation right there in St. Louis. How did you guys partner up? What have you been doing together?
Oh, my relationship with the Arthritis Foundation goes back many, many years. I'm trying to decide if, no, nope, I've been married longer than I've been with the Arthritis Foundation.
Wow.
But 25 years. So I got to know about the Arthritis Foundation when I was a fellow in rheumatology. And of course, at that time, we were involved with the walk and trying to just be active and trying to send our patients and giving them resources to be able to have local centers that they can go to for help outside of our clinic. And so over the years, that relationship has just grown. And I consider, St. Louis to be just so very fortunate that over those 25 years, we've had just great leadership. We've had a lot of movement.
Mhm.
Um, and over the years, the Arthritis Foundation has really taken care of the arthritis community in this area, not just this area, but it goes into Illinois as well, because we're right there on the river. And so it's just been a great, great resource for patients at large.
What's it been like with your connection with some of the patients and maybe even caregivers that you've made connections with and have been able to share that resource with them?
Yes, over the years, we've done, simple things. The Arthritis Foundation in this area used to have grants to go to the YMCA for water aerobics and do water walking, simple things, you know. And those were a huge boon to those patients that really didn't have the ability to do that.
Mhm.
But, you know, again, it was giving them that sense of control and being able to do something if they weren't feeling good, to be able to do something as simple as going to a warm water pool, because if the Arthritis Foundation had a class there, they would maintain their temperature a certain way and so forth. And so, you know, it seems like a simple thing, but for those patients that really needed that resource at that time, it was a big deal for them. And they were always grateful, and they always came back and said, thank you for that. And aside from that, one of the biggest things that the Arthritis Foundation does is it increases awareness, for our local communities, for healthcare providers, and it builds this ecosystem for those, you know, of us that actually deal with arthritis in a day in, day out basis, whether it's providing care or those patients that need the care. You know, it brings together this diverse group of people that have a very core fundamental background and desire to achieve kind of the same things. And the Arthritis Foundation forms a really nice basis for us to be able to do that.
Yeah. And that patient advocacy is so important. And working with doctors and patients together, what's something that you want patients to know that we should be doing to advocate for ourselves with maybe a doctor that's not as compassionate as they should be, and ways that we can actually be helping our doctors give us better care?
Oh, good question, Trina. Um, you know, advocacy, self-advocacy looks different for different
Right.
people, and it varies because you're interacting with different personalities when it comes to healthcare, right? And you may find somebody who doesn't talk as much as, and you might encounter, you know, a provider that might be very open and welcoming that conversation. And so if you're not getting the information that you're needing to help improve your quality of life, you know, I would say make sure that you're getting dedicated visits. You know, maybe you need to take time to have a visit with your healthcare provider that is not just your routine every 3-month visit or a routine follow-up. Maybe you need to say, you know, I came in today because I really want to just focus on lifestyle modification. What can I do? What do I have in my hands, and what do I have the capability of doing to help myself? You know, maybe that's just one visit, and it's a dedicated visit to just learning about, you know, diet and exercise and sleep and stress reduction and all those things that are really important. Because oftentimes what happens is healthcare providers are given only a short amount of time to see you. And you may have multiple things that are going on.
Yeah.
And it's very difficult to address all those problems or issues or concerns in a matter of 10 to 15 minutes. And that's kind of what Medicare insurance companies kind of set as a standard for a routine follow-up. And if you need more than that, then maybe you need to schedule more visits and come back and say, I came back a little sooner because I wanted to talk about this. I think that's a simple way of getting, you know, some of those issues and concerns addressed.
What is something that you wish we understood as patients more about our arthritis?
Well, I think that topography is changing too. I've seen a change in my patients, the questions that they ask me. And I know 10 years ago, even, they didn't ask about lifestyle modification. And I used to try to sneak that into the conversation. And now what I'm finding is that patients actually want that
Oh,
information. And
good.
so they're actually, you know, specifically seeking that out. What can I do to change my diet? And what can I do as far as exercising and so forth? And so, you know, so those are really important things. And if I was to give anybody information as to what can they do, I would say I consider, you know, these 4 pillars of good health, which is what I mentioned: diet, exercise, sleep, and stress reduction.
Mm.
I love anti-inflammatory diet. That has been shown, anti-inflammatory, vegan, these diets have been shown to come out on top for autoimmune disease. And not just for autoimmune disease, but in general for other disease processes as well. So it's important to really look at your diet, try and get rid of some of that processed food, that simple sugar. You know, gluten, dairy also can be very inflammatory. So look at your diet. And I'm not asking for an overhaul. All I'm saying
Yeah.
is maybe just some tweaking and some modification. So maybe it's just meatless Mondays, and that's it for, and ease into it and make it fun. It doesn't have to be a chore and it doesn't have to be punishment for sure. You can get on Google and look up all these different menus and recipes, and maybe, once a week you're just going to introduce a new anti-inflammatory recipe. So I say diet. As far as exercise, I ask my patients to walk 20 to 30 minutes every day. I know it's hard when those feet are hurting or when they're swollen. Maybe it's not 20 minutes that day. Maybe it's just 10, 15. But put those shoes on and get out there, get some fresh air. In the evening, it's still pretty out and it's not as hot. So I think it's nice to be able to get out there. It doesn't require a gym membership. It only requires a good pair of shoes and your time commitment.
Yeah.
And so that's why I ask for walking. Sleep is really, really important. Remember, this is where all of our restorative function takes place in those deep stages of sleep. So that's where you want to be able to get to, not just falling asleep, but staying asleep.
Mm.
And most people are tired. People who have arthritis and inflammation, they're tired. They will fall asleep even in the middle of the afternoon. But what I'm asking for is take inventory of your environment. What is it that you really need to be able to stay asleep? Is that a cold room, a dark room, a fluffy blanket, your favorite pillow? What does that look like for you? And that's different for everyone. So sleep is really, really important, because then when you wake up, I want you to feel refreshed and ready to hit the day. And then, of course, stress reduction. That's
Stress.
a tough one. And what
That
I
is a
ask
tough one.
patients, yes, but cortisol is very inflammatory. I mean, it is one of those triggers that will turn on an autoimmune process and it sneaks up on you. So those days when you've eaten healthy and the weather's nice and you say, what the heck? Look and see, is it cortisol? And what I ask my patients is just to stay in this present moment. This is where your cortisol is really low. But when you're over here in this could have, would have, should have space and you're running that treadmill, that's high cortisol space. If you're living in the past and you're hashing it out, that's not where we want you to be. That's called depression, and we don't want you there. But that cortisol will drive your disease process. So, give yourself a signal, bring yourself back to center. And if you're over here planning, 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 if this happens, we'll do this, we'll buy this, the kids will have this. Well, that's called anxiety, and that's
Yeah.
high cortisol also, and we
Mm.
don't want you there. So give yourself a signal and bring yourself right back here. And when you keep teaching yourself to come back here again and again, this feels really good, and you learn to live here. So the best news about this stress is that it's all learned behavior,
Hmm.
and you learned it as a coping mechanism,
Yeah.
a survival mechanism. And so the best news is you can unlearn it too. And
Continue.
so this is how you unlearn it, and you live here and take it as it comes day by day, and not get too far ahead of yourself, and not spend too much time in the past dwelling on things that could have, should have, would have.
Do you recommend that your patients keep a journal of all of those four pillars of what's going on and bring that to their appointments, or
I love journaling. I
yeah.
absolutely recommend journaling. And what I do is I say, keep a journal, a notebook on your nightstand. And in the morning when you wake up, give yourself a grade. In our office, we use 1 is good, 10 is bad. So I like them to keep it consistently the same scale as what they use with us, so that we're all on the same page. But, for all of those patients that are out there, I would say check with your provider and see what their scale is and try to be consistent with that scale. But yes, then I want you to jot through the day, your stress level. What was that like? What did you eat? How much caffeine did you drink? What kind of exercise did you do? So all those four pillars, I want you to jot. And then even after about 2 weeks, what you've done is you've collected data on yourself, and you're able to see patterns. And if you can do that for a month, even, you'll start to see patterns, and you'll say, darn, every time I eat pizza, the next day I feel like this. I love pizza, but
Yeah.
maybe I should cut back, or every time my mother-in-law visits, no, I'm teasing, but you'll get to see those patterns as to what flares you, and what doesn't, what helps. That's important.
Those are excellent, especially for the patient. What would you advise parents of children with arthritis, or maybe a caregiver of someone who is dealing with that? What kind of things should they be watching for and helping implement into their lifestyle?
Yes. it's hard to be a parent and watch a child with arthritis, but you bring up a really important point, and that is arthritis, especially inflammatory and autoimmune, can affect all ages. And children are affected by this as well. And when they're affected, it's really, really hard to watch as a parent or a caregiver. But keeping this journal and jotting that for them, especially depending on what age they are, if they're younger, trying to take these mental notes as to, what really set that child off. Maybe, there's a birthday party and they had a lot more sugar that day and then they flared the next day. So, note that down, and try to modify those things that you can that are within your capability of doing. We don't have the ability to control everything, but there are a few things we can control. And if we can control or modify them, then that's a really nice, natural way of helping that child. And the same thing goes for older adults as well. If there's something that you're noticing that every time they do this, they might really enjoy going to that park and walking, but it's an uneven surface for them and it really sets off those knees. Maybe try and get them to a more stable place or something that they enjoy doing that's comparable but different, that doesn't set off their disease process. And exercise is really good. Gentle stretching, yoga, these have been shown to be really good for arthritis. Not just arthritis, but it gives you a sense of well-being. Some of those exercises, because of the breathing that you're doing, you're actually, stimulating the vagus nerve. And when we stimulate the vagus nerve, we actually send signals to our spleen to produce our own anti-IL-6 and own anti-TNF. So your body starts to make its own chemistry and treatment. So these are these biologic medications that are on the market, but this pranic breathing that can be done actually can be a natural way of producing your own way to help your body fight off inflammation.
Very good stuff. Let's talk about the Bone Bash coming up in October. You're being honored. Have you ever been before to this event?
I have been to this event many, many times, and over the last 25 years, it's definitely one of our office's favorite events to go to, and our entire office comes out for this each year. So it's fun to be honored, actually, by the Arthritis Foundation, but it's a really fun event. They always do this around October, and so it's Halloween, and they usually something themed, and this year it's a masquerade ball. So that will be fun. But it's a really great way, and this is how the Arthritis Foundation really engages the community. They find these fun events to bring together this large, diverse group of people, from healthcare providers, to patients, and network, build that network for this community. So yeah, I'm looking forward to it.
Me too. I get to MC the event this year. This is my first time coming, so I'll get to come meet a lot of you. I'm very excited. Dolores Hardwick does a
Oh
fantastic
my goodness,
job.
what an amazing addition to the board, and
Yes.
Arthritis Foundation's so fortunate to have her, and she's just done a phenomenal job already. Can't wait to see what she brings to us here in the future too.
Me too. I am looking forward to it. Thank you so much for your contribution to rheumatology and the disease. I feel like it's something, it can make or break how well you feel when you have support from your doctor. And I feel like you're giving that to your patients, and hopefully for a lot of us also, because of the ripple effect. So thank you for that. And thank you for sharing.
Absolutely, Trina. Thank you so much for having me. It's been fun.
Thank you so much. Have a great day. You can watch more, link over to whichever platform you want to watch or listen from runradio.net.